Hey, so a question we often get asked is, can you swallow with Crest White Strips? Basically, while you have the whitening strips on your teeth, are you able to swallow your saliva? Because, while you're wearing it, you will be salivating, actually a little bit more than you normally would because, you have a foreign object or substance inside of your mouth, and that just naturally causes you to start salivating a lot more. Like if you're wearing like retainers or night guards, something like that, once you put it into your mouth, you just start salivating a lot more. um, but yeah, so the first thing we should look at is whether or not Crest says it's okay to do so. So, I mean, all you have to do is just read the instructions on the label. So here we have some Crest 3D white strips right here. And then if we look on the back right here, where is it? Okay, so like, avoid contact of gel with eyes, cloth, leather, or fabric. Wash hands after use. Gel that comes into contact with the skin can cause temporary skin irritation and or whitening. Here, do not eat, smoke, sleep, or drink with the exception of water during use. All right, so they're saying you shouldn't eat or drink with it, but you could drink water while you're wearing the strips. I mean, if you have these on your teeth and some of the gel is leaking out and you're drinking water with it, if they say it's okay, that basically means it's okay for you to swallow your saliva while you're whitening with the Crest 3D white strips on. But in fact, I'm actually going to encourage you to swallow your saliva while you're whitening with the Crest 3D white strips because it actually will increase the effectiveness of the whitening ability of the white strips if you continually swallow your saliva while you're doing the treatment. The reason why is because your saliva actually contains a lot of salivary peroxidase, and as the name implies, the peroxidase is an enzyme that your body naturally produces in the saliva that breaks down hydrogen peroxide, right? Peroxidase, right? So it's an enzyme that catalyzes the peroxide in the white strips, because all the white strips they use hydrogen peroxide right there, right? Ingredients: hydrogen peroxide. So I mean, in other words, saliva is actually the mortal enemy of all teeth whitening products, because you want the hydrogen peroxide to stay there and work on the teeth, bleach it, turn it white, but the moment it comes into contact with saliva, the salivary peroxidase in the saliva will start breaking down the peroxide in the whitening gels, and that will actually decrease the effectiveness of the whitening while you're doing the treatments. So one way to prevent the saliva from coming into contact with the white strips is that you should actually like continually keep swallowing so it doesn't pool around in the mouth while it's like breaking down the peroxide that you want to stay on the teeth. Like an effective way that I've found when I'm using the whitening strips is to, after you put the strips onto your teeth, right? After you put it onto the teeth, you should actually lay down on a sofa or even lay down in your bed. That way your head is kind of tilted down, and then when saliva pools, it'll just go down towards the back of your throat, and it won't really pool in the front where the strips are, right? Because if you're laying down, your mouth is like this, right? And then most of the saliva will be going down, and it prevents it from coming into contact with the strips. I mean, some of it will still come into contact with the strips, but it will be a lot less than if you are, sitting upright and the saliva just kind of pooling around everywhere. So my recommendation is actually to lay down and then continually keep swallowing as soon as the saliva is produced, so that way you prevent it from coming into contact with the strips. So that way you'll get a more effective whitening result when you're using the Crest white strips. So I mean, just to let you know, like one of the major differences as to why in-office whitening with the dentist is more effective than you whitening at home is that while you're doing like the in-office whitening, your dentist has the Mr. Thirsty, the suction, the saliva ejector inside your mouth, suctioning saliva, so it reduces the amount of saliva touching the whitening gel. So it gives the whitening gel a longer working time, and it could work more effectively that way. But you can kind of mimic the results by while you're wearing whitening strips, just to lay down on a sofa or on your bed and just continually keep swallowing the saliva. It's really not harmful if you swallow any of the saliva that comes into contact with the peroxide. While you have these in, it basically just tastes a little bit plasticky, but it doesn't really taste bitter or anything like that. And usually by the time saliva kind of touches the material, it breaks the peroxide down into something harmless anyway. So it's not, it won't kill you if you swallow while wearing the white strips. In case you're wondering why your saliva produces salivary peroxidase, it's actually because there's a lot of oral bacteria in your mouth, and sometimes they produce a lot of peroxide in there. Strangely enough, it is actually your body's self-defense mechanism to break down the bacteria's peroxide, so it does not cause you harm. So essentially, it is a protective mechanism, but unfortunately, it also decreases the efficacy of your DIY teeth whitening products. And that's about it for today.